Docs, I suppose to start off with Omicron variant. Well, it's been here at least for the past 2 weeks already. We've only sequenced it or finished sequencing it in the last few days, but they were here nung November 30 pa and December 1. I don't know how people will react to that news. From your perspective, what should they take away from that story? Na meron ng Omicron dito at nandito na for the past 2 weeks and we don't know if there's more already here and if more are coming. What would you want to tell them, the public?
Can I take that first, Ed?
Sige, Doc. Para pa lang yung Doc, no? Doc Ana.
Well, so I think the public should be reassured that our systems are working. I think that's really the takeaway here, that we've been able to keep doors 1 and door 2 monitored well, no? When we talk about the 4-door response. Kasi ang goal naman, or because we realize that these variants typically come in through travelers, then the focus has always been to try to make sure that returning travelers are not harboring the virus.
Mm-hmm.
So the idea is to make sure that when they come in, before they even come in, they're tested. When they come in, they're tested. And when we allow them to leave the facilities, that they should either be home quarantined or self-monitoring depending on their vaccination status. Mm-hmm. So with the detection of these 2 travelers now, that means that the system actually works. And we just have to keep on doing this or even look more closely at the returning travelers to make sure that hindi tayo malusutan.
Sinabi naman ng Department of Health that the arrival here of Omicron will be inevitable. But this was at a time na sinasabi nila mukhang mild lang to. Now on the other hand, this week nag-report ang UK na meron na daw death according to their Prime Minister. Meron na daw death due to Omicron, and health experts are warning against downplaying the threat posed by the variant. Ano po yung gusto nyong makita ngayon na measures, mga non-negotiable kung sakali, just to play safe? Kasi mag-alert level tayo and level 2 pa rin until the end of the month. What additional measures would you like to see?
Doc Ana.
Yeah. So, well, I think the point kasi is that people should realize na kahit mild, kung ikaw ay may risk factors, kung ikaw ay nasa senior age group, and nakikita natin sa ibang mga bansa, medyo marami ring pediatric population na natatamaan, no? Kung hindi ka protected or you have risk factors, then kahit mild sa iba, sa'yo pwedeng hindi. So, hindi tayo dapat nung pakakampante na sabihin natin na kakayanin natin yan or babaliwalain dapat natin. So, I'm sure sawang-sawa na yung mga taong pakinggan yung inuulit-ulit namin, pero yun lang talaga dapat gawin. Minimum public health standards, yung dapat. Plus, of course, vaccines, no? Kasi ang laki talagang tulong. Nakita naman natin yung impact ng pagbabakuna, particularly in NCR. Napabilis ng husto yung pagbaba ng kaso dahil ang taas ng vaccination rate natin.
Yung isolation protocols, you think they should be tightened, Dr. Rontgene?
Well, I think yung protocols natin, nothing will be changed, no? That will still be in place, and it's just really making people aware of the importance of the health protocols, no? And importante pa rin, no? Active case finding, testing, no? Because we will not know kung may mga kaso unless may magpa-test, no? So even if it's a mild symptom and you know that you have that symptom, we still encourage everyone to get the test. Kasi baka naman kampante tayo, sasabihin, mild lang naman to. And hindi natin alam, it's already the variant and somebody in the family that is vulnerable, medyo matanda or may mga comorbidities, no? So we need to increase the awareness again. Kung ano yung ginagawa natin noon sa Delta, we need to have it at this point in time. Particularly no, we are now in the holiday season. Alam natin sa holiday season talagang nagre-relax ang mga tao. And we had that last year. Case we're going up beginning February, March, no? So we need to learn our lesson at this point in time.
Dr. Rontgene, let me go back to something you pointed out kanina. Given the lag time between the testing of these two and the release of the results today, I think, given that big lag time, you're saying with that much lag time, if Omicron was elsewhere in the country, we would have seen kahit papano indicators already of community transmission. So I suppose by that you mean na mukhang malamang na wala pang iba.
Well, yeah, that's one partly, no? Kasi when we had the Delta variant, no, as far as I can remember, that was 3 weeks after the test was released and the sequence was released. And there were already pockets of cases. I remember Cagayan de Oro, and then there was in northern Luzon, no? And after that, 1 week after, it exploded. Every region already reported cases, no? So nakita ko dito na medyo mas maiksi ngayon ang pag-detect natin. Ibig sabihin, na-detect ka agad. It didn't took longer, and the quarantine policy was in place for all travelers coming abroad. So I hope every contact was tested, and until such time they were negative, bago natin pakawalan sila. We just need to review again, no? What happened in South Africa, what happened in the US and in UK. These countries, when they have the Omicron variant, that was also the time that their masking rules was tinanggal nila.
Okay. That's important.
Tinanggal nila. Tapos, in-increase nila yung capacity sa mga establishment.
Yes.
They were banking a lot on their vaccine. That's why they are the ones, like for example, UK and US, they're the ones who initiated the whole population booster vaccination, because they're so confident that with vaccination, even if you take out the mask and with those health protocols, you want to improve their economy, no? But here in our country, we didn't change our health protocol. In fact, we maintained that. And in fact, IATF recommended na ibalik ang face shield sa mga areas na mga enclosed spaces with poor ventilation. And even if we increase the number of people in the establishment, as long as we have that face mask, the face shield, I think that is enough protection, no, for me. And then we go on with our vaccination. So for me, we are better than these countries at this point in time because of these policies.
Can we afford to be less concerned about Omicron vis-a-vis the Delta variant, given that this is much more infectious than the Delta variant? If we were panicking with Delta, how should we face Omicron? Doctors, kayo po.
Yeah,
So,
can I take that?
Go ahead, Jean.
Yeah. Okay. Let's take this, no? When we have Delta, it is also highly transmissible. We have more cases getting the infection, and we have more people hospitalized now. Now, there's Omicron now, and then people are already vaccinated, no? So the question here is, how one person already vaccinated, what is the risk of getting an Omicron variant compared to an unvaccinated? Ito yung very critical at this point in time. If I'm vaccinated and comparing it with unvaccinated, how will I deal with an Omicron variant? So, alam natin yun sa data sa US, no, which was released the other day. I think 47% of the 143 cases were vaccinated, and they only have mild symptoms. Okay, but their concern is, even if you're vaccinated and you still get the infection, nawala yung infection blocking ability ng bakuna because of the variant. No? So how can we retain that infection blocking? Kasi ang importante pa rin dito, as much as possible, we need to prevent the transmission of the virus. Maski mild lang yan, pero kung dadami ang taong merong mild, meron talagang ma-hospital dyan because of the vulnerable population.
Opo.
So we need to maintain that level of protections na bakunahan. And one of that is giving a booster. But for me, I think even with the booster, pwede ka pa rin. For me, it's really the health protocol that will really be an important part here. Wearing your face mask, avoid gatherings, and face shield.